There's a single team that's at your side and covers you throughout your entire treatment.
It's really about putting the patient at the center of care.
It's about care coordination wherever the patient is and needs to get health care.
It also surrounds them with a team of individuals who are caring and compassionate and want to see the best possible outcome for them.
That's the Cleveland Clinic definition of a continuum of care.
In the past, medicine was sometimes a solo sport. You know, you came and saw the doctor, you spend that 20 minutes with them, and in between times, you were on your own.
The patient-centered medical home concept. This is a new model of care where it's all about wellness and prevention and anticipating the needs of patients. And we are involving each member of the care team.
So it's just not about the patient and a physician, but it's really about building out that team and building face-to-face real relationships over time with patients, with nurses, with pharmacists, with medical assistants, with social workers, the whole continuum of healthcare providers. So they know you by name and you know them by name.
We establish a relationship early on with the patient, and we get the patient involved in their care. We talk about their labs, their diet, their exercise regime, their medications, the problems they may have getting their medication, and together we build a plan for that continuity of care.
The result is that you spend more personal time really with the doctor. He is no longer distracted with making entries into the computer. His time is spent directly with me. This way you really see the doctor.
And if your condition dictates that you need to go see a certain specialist or go to a certain education class, it's going to be our job to make sure you get there.
We're all working together to achieve the same goal of a healthier patient.
The whole concept of patient-centered medical home doesn't just happen in the primary care physician's office. It's all about coordinated care across the continuum. So what does that mean? That means that when I, as a primary care physician, have a patient in the emergency room, I'm going to know about it. And when that patient goes into the hospital and transitions through the hospital, while they might be cared by a physician called a hospitalist, I'm going to know that patient is there.
I'm a specialist in internal medicine. I see all the patients that are admitted to the hospital. My role is to diagnose, to treat diseases. I partner with your doctor. I actually focus on your care when you are in the hospital, and then your doctor can focus more on your care outside of the hospital.
Their job is to really communicate with all those other healthcare team members to make sure that we're delivering you top quality care. We're going to actually follow you home, if you will, as you go. So things like rehab or a skilled nursing facility, we're going to be there right along the way with your healthcare team so that we can make that as seamless as possible.
The primary care doctor is the captain of the ship, and the outpatient services, including home care, outpatient physical therapy, home hospice, home oxygen, mobile physician, are all in direct communication with the primary care doctor through the electronic medical record. We also have access to your doctor's orders, to all your labs and x-rays, and most importantly, your medications. All of these eliminate errors, reduce readmissions, and improve satisfaction for our patients that are at home.
What are the 4 biggest wins so far for patient-centered medical home? Better access, great quality. The patients love it, and so do the providers.
The bottom line is that the patients have direct access to a person that knows their problems and knows their medical care.
We're here to help you. We're here to serve you, and that's how it should be.
We know as long as that's our focus, that we're going to succeed and our patients are going to benefit.